We've been encouraged today to speak from the heart, and I think that is a wise recommendation. I'm actually going to abandon my slides and just try to communicate from the heart. What I'm seeing in clinical practice, what I've seen since I've examined the research literature, I'm fundamentally against misleading people. And so when we talk about depression as if it's this illness, this discrete condition that we can identify, we are misleading people. There is no objective test. When you go into your medical centers, it's usually 8 to 10 minutes. If anything, you're going to fill out a checklist, and you're describing emotional experiences. So what has happened when we've medicalized all aspects of the human experience? Let's look at the fundamental data. Do you think we've reduced the burden of what we call mental illness? Are we better off as a society? You can't fundamentally provide informed consent, which is a legal and ethical imperative, unless you're willing to ask some of the difficult questions that I hope we ask today. If there essentially is no chemical imbalance, right, where a lot of the data is going to really suggest that we're fundamentally experimenting on developing brains, but we've changed our collective consciousness. We've brought things into the lexicon that previously weren't there. And if you want to increase the amount of people who identify with depression or anxiety, if you want to increase suffering, you fundamentally get people to battle their own internal experiences. You learn not to trust your emotions. You judge them as a symptom. You develop fear around them, which is exactly what we have been doing in the United States for the past 35 years. And it's advanced significantly through the year 2020. I think when you look at the actual scope of the problem, I'll tell you what I see in clinical practice. It's rare that we have anyone come into my center without being on at least one drug. Depression has devolved into an umbrella term. It doesn't even have meaning anymore. So it brings into a question the actual research we're going to be discussing today when we don't have an operational definition of the construct, and it's applied to day-to-day sadness. Because if you pay attention to the younger generation, they don't use the word sad anymore. They say, I'm depressed, which is what they then report in their medical centers. So who do we prescribe SSRIs to? What type of women? Well, 13-year-olds who are going through puberty. The after effects of hormonal birth control. Breakups, loss. We prescribe SSRIs for other medical conditions that go undiscovered. So the harm of this goes much greater than what we're just discussing today because it stops investigation. We're facing a chronic disease epidemic, and we're essentially muting the signals. Right? Does anyone believe in here that we've evolved to experience emotional pain or distress, and that somehow is that's somehow a flaw in our genetic evolution? So I think what I want to do is I want to challenge people to have a different discussion, to see everything you experience as a signal, and a very important signal that if you don't learn to pay attention to, then what you're going to do is you're going to surrender your autonomy. You're going to be in a state of fear, and you're going to be dependent on the medical system. Are we better off by being dependent on the medical system? I think there's an awakening right now in American culture where there is a valid distrust of institutions. And this is an institution that you want to question. Because many of the people that I talk to never received informed consent. And it's too late by the time you walk into Dr. Urato's office. You've already exposed that developing baby to an SSRI. And what happens is we're really good at putting people on drugs, and we're really bad at getting people off drugs. And many women feel coerced. And so some difficult questions. Why are we prescribing these drugs at a rate so accelerated compared to men? Is that because this underlying mental illness that we're trying to control for, one we don't test for, when there's no objective testing, it just is more prevalent in women? Or are women just naturally experiencing their emotions more intensely? And those are gifts. They're not symptoms of a disease. So I'm the one guy, I think, here who is providing non-pharmaceutical interventions, and I know what it looks like to go from severely depressed, wanting to end your life and hopeless, to seeing that as a transformational period. And we can do that if we broaden the scope of the conversation. Right? There's a range of interventions. It should not be reduced to psychotherapy or a pill. So I encourage everyone to ask the difficult questions, and let's lively up this discussion, everyone here today, because the American public does not want to look at graphs or meaningless statistics. They want to have a real difficult conversation because that's what's coming into our centers. Thank you.